All right. Well, hello, everybody, and welcome to our week number 4. That means we're going to the 4th game of the season. We have 3 games under our belt. This is our Start or Sit podcast. This is where myself, Shannon O'Kelley, physical therapist, and Dr. Hawkins, orthopedic surgeon, sports medicine specialist, we talk about the previous week's injuries in the NFL, and we talk about, is that player who's sustained that injury, are they going to start or are they going to sit? Are they going to be back? And that helps you kind of make up your lineup for your upcoming fantasy football. Again, wishing all you fantasy players out there a successful season. Again, we're 3 weeks into it. I can't believe we're going into week 4. And the first player we're going to talk about, this guy has been, boy, I tell you, he's been on and off the injury list the last couple of years, if I remember right. That's Justin Herbert, quarterback, San Diego Chargers. I believe they are 2-1 right now, and they are going into a big game this weekend against Kansas City, but they have a bye in week 5. Dr. Hawkins, it sounds like he's been nursing what we would probably define as a lower ankle injury sprain. Apparently he had this the second week in the season. He played third week. He came out of the game. He was seen in a boot after the game, but they think he might rest. They might hold him out this game because they have a bye week 5. What do you think about Justin Herbert?
Yeah, I think he's starting to take on a little bit of persona of his new coach. And, I think that makes it a little bit hard to make a definite decision on him. And also his injury is a little bit of a tweener injury. When he first hurt himself in week 2, he had that exact injury pattern that we see with the bad high ankle sprains. He was planted, somebody came in and twisted him. So it kind of created that twist or spread injury between the tibia and the fibula, those lower leg bones. But he got lucky and didn't tear that syndesmosis, that thick tissue that holds those two bones together. So I guess a best way to think of it is he sprained that syndesmosis ligament and didn't tear it. So that's why he's been able to kind of get in last week. But his mobility is affected. It sounds like they're basically putting him into a boot, as you know, rest that soft tissue. And then, he's a quarterback, so I think he knows what he wants to do system-wide, and his new coach Harbaugh is really emphasizing their running game. So I'm leaning towards him trying to play, but the bad news is he has not been very productive as a quarterback. So, when we sit here and talk fantasy, I don't think he's a great pick, even if he plays, but I think he's going to try to give it a go. I just think you're right. If there's any issues, they're going to have a short leash on him. They may pull him out of the game knowing they've got a whole nother week to rest him after this, especially if they start getting blown out real early. Yeah.
So I guess if you have him on your team, you might want to keep an eye on it. He's kind of day to day. He may play. I'm going to say 50-50 here. I mean, how do you feel about that, Dr. Hawkins? 50-50 on him?
Yeah, I think that's right in the middle. I think you'll see him warm up. I think unless something happens to set him back, I think he will start. But I think the best way that 50-50 number, Shannon, is his productivity. He's going to be 50-50 as a productive player this week.
Yeah. Okay, so he's on that 50-50 list. Keep an eye on him. That's Justin Herbert, San Diego Chargers QB. Like I said, they're 2-1. They've got Kansas City this week, number 4, and a bye the following week, number 5. It may be a good idea to rest him and let him heal up. So we'll keep an eye on him. Sam Darnold, this guy's on fire. I don't know how a player goes from, struggling with the New York Jets on fire with the Minnesota Vikings, 3-0. He has they beat the Houston Texans last week, and the Texans are good, as you and I talked about. He has this thing they're describing as a bone bruise, but, they have a big divisional game against the Packers. And so what do you think? I think he's going to play, but I wanted to get your thought on that deep bone bruise. Again, probably a helmet to the knee, somewhere like that. So let's talk about him. Sam Darnold.
Yeah, absolutely. This is, they got lucky. He did have a direct blow. I think they were concerned. We've seen those sort of PCL injuries in the knee sometimes where it doesn't look that bad, and then you get the MRI and realize there might be a ligament damage. But it turned out he just had that deep bone bruise. You've explained it very well in the past where, the bone has that periosteum, that skin on the surface of it that is very innervated with nerves. And so can make it very uncomfortable, but structurally he's good. I think he is really showing a resurgence. For everybody out there who thinks that Bryce Young is done and toast, I think, they have to look at Sam Darnold and realize, hey, maybe Bryce Young can end up with a different coach in a different system, and maybe he won't be a bust. But yeah, I think Darnold's going to play this week. I think he's going to go, and I think he's channeling his inner Ben Roethlisberger right now.
Yeah. I mean, the guy's on fire. Good for Sam Darnold. He did have an MRI on Monday, and it came back negative. Like you said, he kind of got lucky here. Deep bone bruise, probably a little painful, but I think he's going to go. And he's going to go because it's the Packers, and it's a divisional game, and Minnesota and Packers are always a good game. Talking about the Packers, you and I talked about this player, Jordan Love, Green Bay Packers. I think week 1 we talked about him. He had what we described potentially as a grade 1, maybe 2 on the grading system, MCL, medial collateral ligament of the knee. We pretty much talked about him, thought he was going to be out 4 to 6 weeks. Well, here we are talking about week 4, and I think he's practicing. I think Jordan Love's getting some reps, and he's kind of day by day. And because it's a divisional game, I'm wondering if they're going to play him. I wanted to get your opinion on Jordan Love.
Yeah, he's right at that beginning time frame where you expect the biology of the MCL to have allowed it to heal. So that inner ligament on the knee, it's probably stable. When they examine him and they push on that knee, he probably doesn't have any significant laxity. So he has been practicing. He's been wearing a light hinged brace. Last week, they actually had him do a pretty aggressive warm-up before the game, not because he was going to play, but just to try things out. And I agree. I think they're leaning, this, again, big game, big opportunity for him to get out and to, establish, who's going to be ahead in sort of that NFC Central. So I'm leaning to him playing. I think, his coach really keeps things close to the vest. They let him warm up, and then they don't have the media there for any of their actual live practice. So you don't see how much time he's spending with the first team. So, this is a hard one for me. If I had him on my team, I would wait till the very last minute and see if he's going to play. Because I think if he plays, he's got a chance to put up really good numbers. And he is right at that point where he can probably safely do it.
Yeah, good points. I'm thinking he's the play just because it's a big game. And it sounds like he's been doing pretty good as far as practicing. Here's the deal. Let me ask you a question from a professional perspective. You talk about the MCL. We know the MCL, the medial collateral ligament, stabilizes the knee on the medial or inside. So a lot of times in our business, we call that a valgus stress. If you get hit and your knee is bent to the inside, the medial collateral ligament is the one that's usually sprained or injured. You mentioned a hinge brace. In your professional opinion, because I've read some research on this, just kind of inquiring here, how do you feel about those braces? Are they helpful, or is it more proprioception? Is it more just confidence? I mean, do they work? I guess that's what I'm asking you. And I'm not trying to put you on the spot here, Dr. Hawkins, but I just want to see what you thought.
Yeah, totally. There's 2 ways to look at it. One is the prophylactic bracing, which is like every offensive lineman wears 2 of them on either knee. And I think that's just a confidence level that, okay, if somebody rolls up on me, my injury won't be as severe. But you see those guys going down all the time, grabbing their knee, and that happens when they're wearing their brace. So I think the prophylactic bracing is a hard one. I think everybody does it because it makes the offensive lineman feel better. As far as coming back from an injury, when MCLs heal, some of them heal with a little bit of that residual laxity, a little bit of residual valgus laxity. And so in those instances, the basic analogy I'll give to a patient is you're taking your 4-legged chair and you're taking 1 inch off of one leg, and then you're going to sit on that chair. And if you're a heavy guy or somebody bumps into you like a big dog, you're going to tip over easier because that one leg is shorter. So in those instances, I do think when you're coming back from an injury, having that brace in the beginning is very helpful until you get your full strength and your proprioception back. So for those high level ones, I do think it's a really good thing to put them in a hinge knee brace in the beginning, but graduate them out of it. They work with great physical therapists. They learn their proprioception, they get their strength back, and then, they can wean off of that in 4 to 6 weeks.
Yeah, and that's really what therapy is all about today with these ligament sprains, is really kind of enhancing the proprioception. For our listeners out there, what proprioception is it's essentially nerves that run in the ligaments, and when those ligaments feel a push or a pull, it causes the muscles around that joint to fire. So that proprioception tells those muscles to fire. Essentially, that's kind of a simplified version, but it's very important that these athletes have good proprioception, particularly if they're mobile and they're dropped back and they got to go lateral to medial, i.e. cutting. So I'm thinking he's a play, and I think you're kind of on that same line as I am.
Yes.
Yeah, okay, good. Adam Thielen. I always have a hard name. Adam Thielen. Sorry about that. He is the wide receiver, Carolina Panthers. Hamstring. Had a significant hamstring. He went down on tape. You could see it was a significant injury. He's on the IR, so he is out for 4 weeks. We talked about the IR. If you go on the IR, you're 4 weeks out, right?
Yeah. So he's a significant injury can be two different things with hamstrings. The most common, which is of the significant ones, is sort of the muscle tendon junction injury. So the muscle belly, narrows down, becomes the ropey part, the tendon. And so that's where a lot of these injuries happen, because it's between the muscle fibers, which have a little more give, and then the tendon, which isn't as stretchy. But those can be substantial injuries. They can knit together, but they need time. And that's the kind of injury he suffered. They were very clear that he would not need surgery. The other type of significant injury is when the actual end of the tendon, where it attaches to the bone, most commonly up, in your rear end where you sit, at your ischial tuberosity. If that pulls off, then that becomes a surgical one. So he got lucky in that he doesn't need surgery, but he's 35. He's a skill player, and these are the ones that start to make us nervous that 4 weeks is going to turn into 6 or 8 weeks, because it's hard to come back from. We've had our Keenan Allen discussions in the past.
Yeah.
We've had our Darren Waller discussions in the past, like those guys that just seem to have a hamstring injury that ended up going much longer than expected. So I think he's definitely not playing this week, and I think you might have to think about replacing him on your team. Because I'm not even sure in 4 to 6 weeks how good he's going to be.
Yeah, it sounds like a pretty significant injury. Again, in medicine, we like to grade these injuries, particularly these soft tissue injuries, and it's probably a significant grade based on he went down, and they have him on IR right now for at least 4 weeks. And like you said, early in the season, I mean, it's biology. We've talked about this before. If you get these players back too early and re-aggravate that, it just slows the recovery, and sometimes it can be a season ending or a season lengthening, or you can take all season for this stuff to heal, so to speak. So he's out, definitely. He's out this week and probably sitting at least somewhere between at least 4 weeks being on IR. Okay, is that fair to say on him?
Yep, absolutely.
Okay.
Absolutely.
Here you go. I've got a special one for you because I know you're a Philly fan, an Eagles fan, and your guy, wide receiver Britton Covey, went out with, and I tried to find out what's going on. All I could find out is he has a broken bone in his shoulder, and I'm guessing, humeral head fracture, something like that. I mean, neck fracture, the humerus. But he's on IR. I think he's going on IR for 4 weeks. What do you know about Britton Covey, wide receiver, Philadelphia Eagles?
Yeah, and he's also an ex-Utah Ute, which is where I did my sports medicine fellowship. So in some respects, I've got a lot of reasons to like this kid. But he was a direct blow to the lateral aspect of his shoulder. He kind of juked one guy at the sideline and was kind of about to step out, and he got hit really hard and then went down. So they have been very coy about giving specifically what he broke. So that all sorts of speculation out there, but I think the simplest thing to say is they said 6 weeks. So it's not going to be a clavicle fracture, because that's not going to be healed enough in 6 weeks to go back unless they were putting a plate and screws on it, which they're not. So I think you're right. You could be getting into something that's some type of maybe an impaction injury to the humeral head that wasn't significantly displaced, or the other possibility is maybe like a small fracture to what's called the scapula, the shoulder blade.
Oh,
And that's a an injury that's painful, but because that bone is sort of surrounded by muscle, as you know, it's kind of protected. So it's just a pain thing, and let it start to get a chance to knit. So I think that's what I'm leaning towards a little bit, is maybe some type of scapular body fracture, didn't go into the joint, so it's not anything they have to worry about surgically. And then, again, 6 weeks to let that early knitting go on, and then get him back out there. But he will definitely not play this week. And for my family, my extended Eagles brethren out there, that's hard. He had stepped in with all their other injuries at wide receivers, and so that team is really, really thin right now at the wide receiver position.
Yeah, he's out. He's out at least if he's on the. I'm not sure I know the answer to this, but maybe you do, Dr. Hawkins. So if you place someone on the injured reserve, I think we've talked about this a little bit, just to confirm your knowledge. If someone goes on IR, they're out for at least 4 weeks. We know that. But my question is, if they heal fast, let's say they recover, can the team bring them off IR before 4? Are they allowed to do that? I don't know the answer.
No, you're limited. I mean, you have to minimum 4 weeks.
Okay, got it. So he's on IR. So Britton Covey's out for at least 4 weeks right now. Here's the guy that we've talked about before a lot. And we know Cooper Kupp has been out since at least week 2, if I remember right. He has an ankle sprain, but they're talking about him practicing a little bit and maybe taking a look at him. But they have a week 5 matchup with the Packers, and they have a bye on week 6. So he's week to week. But what do you think about this 4th week coming up with everything? Well, and they're 1-2, by the way. The Rams are 1-2.
Yeah. I think that he's another one that, kind of like we brought up earlier with Adam Thielen. He's getting a little bit older, and he's starting to get these nicking injuries that keep kind of cropping up, and I don't think you heal as fast. In prior years, we've always established he's one of those guys that's as tough as nails, and he'll go out and play through things perhaps quicker than he should. But I think the problem right now is I think he's going to be a hard guy to heal and recover and gain his ability to move laterally. So I think he'll be out this week. They kept him off the IR, so I think they're going to continue to work him week to week, but I think he will not play this week, and I still think he'll probably be 50-50 even next week.
Yeah, that's what they're kind of saying. They're kind of keeping an eye on him, and even they're talking about week 5, he might be out still week 5, so probably not playing week 4, and then keep an eye on him for week 5. I think they have a bye week 6, so they may just give him extra time to recover. That would give him 3 extra weeks, and then be back after that, at the 6th game of the 6th week. So I feel bad for him. They really need him. He's a producer. Here's another tight end, Sam LaPorta. I like the Detroit Lions. I'm kind of their fan. I like their coach. I like his enthusiasm. He's got a low ankle sprain, Sam LaPorta. They beat the Cardinals on Sunday. And I don't know. He was on and off the field during that game, and so he avoided that. We talked about that severe injury. Apparently, it's a low ankle sprain. He avoided that high ankle sprain. But it sounds like they're keeping an eye on him, that he possibly is to go. What do you think about Sam LaPorta?
Yeah, the one thing going for him, I mean, if you actually saw when they took him off the field, I mean, I think everybody thought he was, done, like he's going to have surgery type of thing because they took him off on a cart. But he was lucky in that it was an ankle injury that's just at the lower part, down by where the foot kind of attaches to the fibula and the tibia at the very bottom. So what's going for him is he's young. And so just like when you sprain your ankle at age 18 versus you sprain it at age 40, sometimes in a couple of days you're surprisingly moving well. The concern is he hasn't been super, super productive. Their team's doing well. They do have a lot of options between, like, Jahmyr Gibbs as a running back, Amon-Ra St. Brown is wide receiver. So they've got good options for Goff to throw to, and even his backup Brock Wright is a solid tight end. So I think I would lean to him sitting a week and just recovering fully, and then being solid going into week 5.
Yeah, that's probably a good idea. So he's most likely you're leaning towards he's going to sit, heal up, and be ready week 5. Hey, You know what? I want to let you know. Yeah, we talked about your Philadelphia Eagles, and I know that you live in the Northwest now, down in Olympia, and I know that you're a closet Seahawks fan.
Absolutely. I adopt where I am 100%.
You're awesome. They're 3-0. There's only 5 teams in the NFL right now that are 3-0. So they've been fairly injury-free, the Seahawks. But I do want to talk to you about Kenneth Walker III. I keep waiting for him to come back. I think we talked about him week 1 or 2, and we talked about an abdominal or some kind of a torso abdominal strain, muscle tear, but he did not play last week either. So those things can be pretty tough in that core muscle group. You think he might play this week, or do you have any insight on him?
Yeah, they've been pretty quiet about where he's sitting, and I think some of that is because they've been doing okay. And so I think there hasn't been a lot of pressure to sort of say, well, why don't we have him back? I mean, I think if they were really struggling, they haven't won everything incredibly in a dominating fashion, but they've been efficient when they needed to be. And so I think that he's kind of flying under the radar. And as a result, I think there's less pressure on him to, force himself back into the lineup. I mean, all of these guys are super, super competitive. They all want to be out there. And I'm sure he's exactly like that. But, as we've mentioned with these soft tissue injuries, sometimes they just aren't healing as quick as possible. And back to that analogy of a race car, they've got a little part that's just not quite moving right for them. And so their trainers are probably keeping a good eye on him. And if they don't feel he's moving well and they're not struggling in that position, they're gonna hold up. So I wouldn't be surprised if he starts to integrate into maybe playing a little bit this week. Like maybe he gets a few carries and starts to work his way back in gradually rather than just boom, he's suddenly the starter. Yeah.
And, and we talked about this in the past also, those abdominal injuries, those core muscle injuries, those are really difficult. I mean, because everything you do starts in your core, particularly when you're a running back. And, you can't, there's not any real significant bracing or any kind of stabilization out there. You just got to let those things heal. And they can take a little while. So you think he might play, keep an eye on him. So Kenneth Walker III, he might be ready to get back. I'm not even sure who I don't even know who they have this weekend, but keep an eye on Kenneth Walker. Dr. Hawkins, once again, great job. I mean, you do such a fantastic job explaining the biology, the anatomy, the mechanism of injury, the return. It makes a lot of sense chatting with you, and I really appreciate our time together. And there you go, starter sit fantasy football. Is your player going to start or sit going into week 4? We just reviewed week 3 injuries. Everything you need to know about players right there. Thank you, Dr. Hawkins.
Yep. Thank